Hello, my name is Cholera Aluko, and I am a public health student at the University of North Carolina at Greensboro, and I will be presenting today about cholera. Cholera is an acute diarrheal illness caused by infection of the intestine with the bacterium Vibrio cholerae. Only 1 in 10 infected people develop the typical signs and symptoms, which includes diarrhea, nausea, vomiting, and dehydration. If not treated, dehydration may lead to loss of minerals, which can result in shock. This is one of the most serious complications of dehydration and can eventually lead to death. Cholera affects 1.4 to 4.3 million people worldwide and causes between 28,000 and 142,000 deaths per year. This is a graph from World Health Organization which shows the epidemic of cholera. The outbreak still affects several continents and poses a serious public health problem among developing countries with no access to clean water. In 2013, 43.6% of cases were reported from Africa. 47% of reported cases in 2013 occurred in the Americas, mostly in Haiti. Only about 10 cases of cholera are reported each year in the United States, and half of this are acquired abroad. We can't talk about cholera without mentioning Dr. John Snow, who is an iconic figure in epidemiology and in public health, and he was best known for his work on cholera. In the mid-19th century, during the Great Cholera Epidemic in London, Dr. Snow published this map to support his theory that cholera reproduced in the human body and was being spread through contaminated water. The map shows the location of the 13 wells in the area and the 578 cholera deaths, which was mapped by the home addresses. This is a close-up of the map that Dr. John Snow had of the Broad Street pump, which was marked by black bars stacked perpendicular to the streets, which showcased how many deaths there had been in different homes. And over the years, several scientists have developed Dr. John Snow's idea and were able to find different causes of cholera, which includes food or water contaminated by feces, municipal water supplies, foods and drinks sold by street vendors, raw or undercooked fish, and seafood caught in waters polluted with sewage. Cholera can be diagnosed by examining stool samples or rectal swabs, but due to fast-acting nature of the disease, there is often little time to do so. So, in epidemic situation, a diagnosis is often made by taking a patient's history and conducting a brief examination. There is a vaccine for cholera, but if you've been infected, staying hydrated is very important. And oral or intravenous solutions are used to replace lost fluids. Preventative measures include drinking boiled or chemically disinfected water, drinking bottled water, and avoiding raw or undercooked food. But most importantly, washing your hands. Washing hands help stops the spread of cholera. That concludes my presentation, and thank you for watching.